I'm Stephanie McBride, and I'm going to tell you how you can learn more about using essential oils during maternity. So I got started as a clinical herbalist and functional nutritionist, working with my clients who mainly were in the demographic of women preparing to have babies, so boosting fertility and just overall like doing detoxification, diets and things like that to get ready for pregnancy. And then they just stayed on as my clients, and so I was coaching them throughout pregnancy and in postpartum, and then I worked with their kids in infant care and children's health and allergies and things like that. And as I started to get more interested in using essential oils because of their convenience and efficacy and how easy they are, I started to think I don't know enough about essential oils for maternity to really be doing this with people. So I actually started to study this very intensively. And this was about 10 years ago at this point, but I created, after about a year of research, study, interviewing different midwives from all over the world, using the oils in my own practice with people, and I also even did a case study. I created a course, a continuing education course for birth professionals. And the handout for the course has later been turned into a couple different things that I have available now. So I do have a tear pad, and this is basically like everything that I learned in a year and then tried and then corrected and made better, all of that information turned into this simple tear pad, which has things like uses in pregnancy, and then it will say the discomfort like common cold, constipation, fatigue, fever, and then tell you which oils I would recommend and how to apply them. There's also information for uses in labor and for uses in postpartum. And I have blends for the childbearing year and also safety guidelines and how to apply the oils, different methods of application and how much you would use. So usually we adapt use a little bit for pregnancy because women's skin is more sensitive. There's certain things that you would want to change a bit when you get pregnant. So this sheet is really an easy, simple thing to hand out to someone who is interested in using essential oils and wants some basic guidelines. There's also a pink book available through Your Oil Tools and other distributors that is a much longer version of this. This is basically the notes that I use to develop my e-course. And it's all put into a book form with blends for every phase of pregnancy. And so that's really handy. It's kind of like a guidebook, user's guide that you can just look up and reference things. There's lots of charts. There's charts on like which carrier oil you would use if your child, has issues with their skin, for example. So looking at a lot of different details there. And then I have a longer book called Essential Oils for Maternal Wellness. And this book goes into much greater detail. And I also bring in my knowledge as a nutritionist. And so basically I talk about the applications, which are aromatic, topical, and internal, and go into details about like what those applications do, like when you might choose which one. And then I talk about essential oil quality, how to pick which oil brand you're going to use, and which different factors go into that. I have a whole section on dilutions and concentrations, through different phases of pregnancy, labor, postpartum, infant care, and up like as people age until the adult years. And then my safety guidelines section is very thorough and complete. I tend to be more conservative than others about safety, but I just want to make sure you have all the information out there so that you can make an informed decision on how to use the oils. They are very safe and versatile during the childbearing year, but there are a few things to keep in mind. For example, when women are pregnant, they are more sensitive to the photosensitizing essential oils because they have higher levels of the melanocytic hormone. So that just makes them more sensitive. It doesn't mean you can't use citrus oils and things that are photosensitizing. It's just that I want you to be aware that maybe you could use them before you're pregnant, but now you should just keep an eye on that and be really mindful so that you don't have too much of that in the sun since your body's changed. And then I have in the main section specific use guidelines, and I start off in pregnancy, and kind of in the order they occur, I go through all the top symptoms or discomforts you might have, including things like back pain and nausea and things like that, and then go on through labor, postpartum, delivery, infant care. And in each section, I tell a little story about like my own, it's kind of a narrative about my own experience. I did not have the oils during my childbearing years, unfortunately. I have 3 teenagers now, so I just kind of missed out on all of that. So then I talk about in hindsight, like, yes, I had this going on. In hindsight, here's what I wish I could have done, here's what you can do. And then I go into like really like why do people have back pain during pregnancy when they didn't before? Like what's going on with that? Like what are the hormonal changes contribute to that? And it's really broken down very simply, but it just helps you to say, oh, okay, I get it. I get why that's happening. And then there's a short section on nutrition, my top essential oils I'd recommend and their precautions, different applications for each individual thing that may be coming up for you. And then in the back, I highlight my favorite essential oils during childbearing. So if you're looking at, okay, which ones do I actually want to bring into my childbearing year? And you can go in and read about the special qualities of these oils. And this comes from an herbalist perspective and 20 years of studying herbology. So that's the book in short, and I really hope that you'll check it out and enjoy it. And also, I have an e-course. So if you're someone who would like to go another step further, or you like to learn through like keynote webinars, and there's 5 quizzes. Once you go through the course, if you're in the United States, you can apply for CEU credits and get between 5 and 6 CEU credits for taking the course. And if you would just like a general certificate of completion, then you can also have that, and that will show that you have a baseline knowledge and are competent in recommending essential oils during the childbearing year. So that course is called Essential Oils for the Birth Kit, and as well as these other materials. I hope that you'll find what you're looking for, and I hope to see you again. Bye.